Hello everybody, my name is Luke Yochimowitz and I am group 3, which is the eye, mouth, and nose. I am going to attach a Quizlet link to the end of this presentation that has all the definitions I'm going to use. So if anything's unclear or you didn't have time to write down a definition, don't worry because all the definitions will be in one collective place at the end. Alright, so first we're going to start with a coronal cross-section of the human eye. And in this slide, I'm just going to present the terms that I'm responsible for covering in this section. The first image was a bit too complex for this presentation, so I found a simplified drawing of the coronal cross-section. And up first we have the sclera, which is the external body of the eye. It is the white of the eye that is visible from the outside. The middle layer here is the choroid, which is the vascular layer of the eye between the retina and the sclera, which makes this layer here the retina. Now the retina is the light-sensitive inner surface of the eye, which contains the receptor rods and cones. It also has layers of neurons that begin the visual process. The optic disc is located down here. It is a hole in the retina where the optic nerve fibers exit the eye, and right here is actually where you're going to have a blind spot in the eye due to this optic disc, which is where the nerve and the veins and arteries come out of. So now let's talk about the nerve. It's the optic nerve, which is the nerve that carries the neural impulses from the eye to the brain. Down here is pointing to the vitreous humor, which actually occupies this whole posterior cavity here. It is the jelly-like substance found behind the lens and is once again in the posterior cavity of the eye, which kind of just helps maintain its shape. Up here we have the lens. Now the lens is very important. It is the transparent structure behind the pupil that changes the shape to help focus images on the retina. And in another slide, I'm going to talk about how the muscles kind of constrict, and can help change the focus of the lens. Up here, we have the cornea, which is just the clear tissue that covers the front of the eye. Sometimes it gets scratched. Here we have the iris, which is a ring of muscle tissues that form the colored portion of the eye around the pupil and controls the size of the pupil opening, which will then determine how much light actually gets into the eye. And here we have the ciliary body. Now the ciliary body is structure surrounding the lens that connects the choroid and the iris. It constricts the muscles, which control the shape of the lens, and it secretes aqueous humor. Now I'm briefly going to talk about tapetum lucidium. Although human eyes lack a tapetum lucidium, they still exhibit a weak reflection from the fundus, as can be seen in photography with the red eye effect and with near infrared eye shine. So if you look at the picture to the left here, we have an image of light passing through the iris, hitting the lens, and then reflecting off of the fundus, which is just a curve of the retina. And then this reflected light actually passes back through the lens, and then that's how we get a red eye effect. The tapetum lucidium is usually used for nocturnal animals that kind of give them some sort of night vision properties. This slide is on the zonular fibers. Now the zonular fibers connect the ciliary muscles with the lens of the eye. Then the ciliary muscles are found in the ciliary body, which control the shape of the lens and secrete aqueous humor, as I previously mentioned. And now these fibers located here posteriorly and here anteriorly will tug on the lens depending on whether we are trying to focus on something far away or up close. Here is a coronal cross-section of a cadaver eye, just to give you a more real picture of what some of these structures look like. We have the three layers of the eye here. We got the retina at the back, posterior curvature. The chamber here would normally be filled with the vitrinous humor, the lens, and of course the pupil and cornea. Now I'm going to talk about a clinical case. Some of you may recognize what this disease is just based on the picture, and it is glaucoma. And glaucoma is an eye condition that develops when too much fluid pressure builds up inside of an eye. It tends to be inherited and may not show up until later in life. The increased pressure, called the interocular pressure, can damage the optic nerve, which transmits images to the brain. If damage to the optic nerve from high pressure continues, glaucoma will cause loss of vision. Without treatment, glaucoma can cause total and permanent blindness within a few years. So, just as an example, an elderly woman aged 65 who's a retired preschool teacher who has not had an eye exam in the past 8 years. She presents with blind spots in her peripheral vision, blurred vision, and eye pain. Some of the causes, which I mentioned in the previous slide, is just that damage to the optic nerve due to the pressure of the aqueous humor, and the fluid normally drains through a tissue called the trabecular meshwork, which is located where the iris and cornea meet. And if this aqueous humor is not able to be drained properly, that's where we get that buildup in the eye, which could result in some blindness if left untreated. So now there's two types that I want to just briefly mention. You can look at this presentation then. There's the open angle glaucoma, and this is like the less intense form. Like later in advanced stages, you might get some of that tunnel vision, and this form is treated more easily than the angle closure glaucoma, which can have some severe symptoms here. And it occurs when the iris bulges forward to narrow or block the drainage angle formed by the cornea and iris. Some treatment options for glaucoma include eye drops, which is usually the first step when treating glaucoma. They are prescribed eye drops and they help decrease the pressure by improving how fluid drains in your eye or decreasing the amount of fluid your eye makes. We have some oral medications which also inhibit some of the fluid that your eye makes. And there's surgery and some other therapies. The laser eye therapy is used a lot to treat some more severe cases, and they are intended to improve the drainage of the fluid eye, which there will lower the pressure within the eye, and in a lot of cases this is pretty successful, but if glaucoma is not treated and not treated in a timely manner, it can cause permanent blindness. The next section in this presentation is the oral cavity, which is the mouth, and I'm going to start off by showing the terms that I'm responsible for covering here. And right away we're going to tackle two of them, which one of them being the soft palate, which is located in the posterior portion of the mouth, is not supported by bone. And I'm also going to mention the uvula, which is the soft tissue hanging from the middle of the soft palate. And in this picture, it's really hard to find a good representation of this part, but we have the sulcus terminus, or terminalis, rather, which marks the border between the mouth and the pharynx. We have two muscles that we're going to focus on here. The first one is the genioglossus, which depresses and protrudes the tongue. If you look on the right side, you can see it kind of posterior to the mandible. And then the mylohyoid, which elevates the hyoid bone and the floor of the mouth. And I have a slide separate just on the hyoid bone so that can kind of put it into better perspective. But again, if you would look at the illustration on the right side of the screen, you can see it at the very bottom of the picture. Here we have an illustration of the submandibular gland, and now this gland is responsible for creating saliva underneath the tongue. In this picture, you can also see some other glands. You don't really have to worry about those too much, but I just figured it would be nice to kind of put into reference what else is kind of going on there. Now I'm going to talk about the two arches. The first one being the palatoglossus arch. It is on either side. It runs downward to the side and forward to the side of the base of the tongue, and is formed by the projection of the glossio-palatine muscle, with its covering the mucosal membrane. And that one is depicted in yellow in the illustration above. There you can see what nerve innervates it. It elevates the tongue and depresses the soft palate. And now the palatopharyngeal arch is the entry from the oral cavity into the throat, and this one is depicted in that light blue / teal. Also in the oral cavity are obviously teeth. Here I included a diagram of both the primary teeth and secondary teeth, and you'll see the distinction here is the inclusion and addition of premolars in the secondary teeth. Incisors are teeth between the canines that are used for cutting, depicted in green. The canines are the red teeth here, and there are teeth in the front of the premolars that rip and tear food. The premolars then are in yellow, the teeth immediately behind the canines used in chewing, grinding, and shearing food. And molars are the ones in the back. They are depicted in blue, and they grind the food, and they have those deeper kind of depressions that really help tear apart and grind some of like the leafier type foods. And I decided to include an acronym for this slide, ICPM. I had some trouble honestly thinking of a couple, but one that I settled on was I can pass math, or Italians created pasta and meatballs, whichever one helps you out there. Now I'm going to be talking about and discussing the nasal cavity, and here are the 3 bullet points of terms that I'm going to be covering in this section. Up first, we're going to be talking about the superior, middle, and inferior nasal cochlea, and sorry, I just had to get out the laser pointer here. The function of the cochlea is to increase the surface area of the nasal cavity. This increases the amount of inspired air that can come into contact with the cavity walls. They also disrupt the fast flow of the air, making it slow and more turbulent. So here, I like these because they're fairly named kind of smartly, because it's just superior, then you got middle, and then inferior cochlea. The superior is not a named bone, but it's part of the ethmoid bone, and it's obviously above the middle. The middle here is spongy. It's on a bony palate with curved margins. Part of the ethmoidal labyrinth projecting from the lateral walls of the nasal cavity and separating the superior meatus from the middle meatus, which I'll be discussing in the next slide. And then obviously underneath it is the inferior nasal cochlea, which is located on each side of the nasal septum attached to the lateral walls of the nasal cavity. This increases the epithelial surface area and creates turbulence in the inspired air. Up next, we have the superior, middle, and inferior meatus, which also correspond to the cochlea, which they border and share with. So just from anterior to posterior here, we have just superior, middle, and inferior. Now, these here are very important in drainage. For example, the frontal, maxillary, and anterior ethmoidal sinuses open into the middle meatus here. The location of this opening is marked by the semilunar hiatus, a crescent-shaped groove on the lateral walls of the nasal cavity. And it extends from the anterior to posterior end of the latter. These pictures are depicting the nasal septal cartilage, which make up the anterior inferior portion of the nasal septum. So as many of you know, the very tip of the nose is actually just cartilage, and it's connected to the nasal bone. And if you would take a second, you could actually feel the separation about halfway down your nose, and you can even push around this cartilage. Here is just a cadaver, another coronal cross section here. I just want to focus on three structures here. If you would draw your attention to number 6 here, this is the frontal sinus, which I'll get into in another slide. The saphenodal sinus is number 21, which is located right here. And then number 22, you can see the optic nerve actually leave the front of the face. And here you can also see all the ethmoidal sinuses and some of the airways and passages, and obviously the tongue and mouth are down here. Now let's actually talk about the skull sinuses. First we have the frontal, which I just showed in the previous slide. The frontal here, you can see both an anatomical position and from a lateral side view. The frontal sinus is a cavity within the frontal bone. The saphenodal is a sinus on top of the middle half of the head, which I think you can only see from the side view here. The maxillary obviously pairs up with the maxillary bone, is the largest of the facial sinuses. It's pyramidal and on the cheekbone lateral to the nose. And then that just leaves the ethmoidal. And this sinus here is the nasal sinus located between the nose and the eyes. The last section is the pharynx. And once again, the terms that I'm going to be discussing in this portion are found here. Up first, we're going to be talking about the regions. So we have the nasopharynx, which is in blue. And this region of the pharynx at the back of the nose and above the soft palate here. The oropharynx, which is the central portion of the pharynx between the roof of the mouth and the edge of the epiglottis down here. And then we have the laryngenopharynx, which is illustrated in purple here. This constricts the pharynx during swallowing, and there will be some muscles that I'm going to be talking about that will help explain that process. Here is the hyoid slide that I talked about. It is a U-shaped bone in the neck that supports the tongue. And I included a diagram that shows the anterior view and the right lateral view. In many cases, a coroner can actually determine if somebody was strangled because of a broken hyoid. So I don't know if some other people watch some of those like FBI type shows, but that's what I've gained from watching those. Here is the pharyngeal constrictor muscles, which constrict the pharynx during swallowing. And then they're listed in the right, a bit easy to follow. They have the superior constrictor muscles, the middle constrictor muscles, and the inferior constrictor muscles. And I think those are the three that we should focus on. Also included is illustration of the esophagus, which is also very useful during swallowing. In In this slide, I have two pictures illustrating the auditory tube opening, which aerates the middle ear, clears mucus from the middle ear and the nasopharynx. And if you look to the illustration to the left, you can see it kind of go through and then meet the sinus. This last slide is the superior cervical ganglion, which is the site of postganglionic nerve cells that elicit dilation of the pupil. And there it is in writing, in case you missed it. And I also have a Quizlet of all the terms that I just mentioned. So if anything was unclear or you weren't exactly able to hear what I said, I'm going to be attaching that also with this presentation. And thank you very much.